Whenever I tell people that I'm a psychologist, it usually leads to a number of follow-up questions. And one of the most common of which is, are you psychoanalyzing me right now? And the answer to that question is no. Psychologists don't psychoanalyze everyone they meet. At least I don't. It's just one of many questions I get about my job. And I think part of why people ask so many questions about what it's like to be a psychologist is because it's kind of a unique and strange job, and everyone has heard about it, but not a lot of people really understand what it's actually like to be a psychologist, what the day-to-day life of a psychologist looks like. And so in today's video, I want to pull back the curtain a little bit and talk about my experiences as a psychologist and what the job is like from my perspective. And I'm going to be talking mostly about the therapy relationship and what therapy is like from this perspective of a psychologist. I think it's important to understand what a strange and unusual social interaction and relationship that a psychologist has with their clients. In no other relationship in which you're interacting with another person will you ever find yourself in the same type of relationship that a psychologist has with their clients. Because what happens is a person comes into my office and I do an assessment where I ask them about the problems that they're wanting to deal with. And I ask them really detailed, personal, private questions, usually within the first few minutes of meeting the person. And as you might imagine, it's a bit weird from the client's perspective to completely open themselves up and share all of these deeply personal, private, intimate details about potentially some of the worst things they've ever experienced in their lives. And they're doing it with a complete stranger. So I tend to be hyper aware of how unusual and strange and uncomfortable this can be for clients. And so my goal is to try to be as empathic and caring and nurturing and non-judgmental as possible, because I'm asking somebody to do something that and I think most people would find really, really difficult to do. But the unique thing about the psychologist-client relationship is that it's not reciprocal. The client is encouraged to tell the psychologist some of the most intimate details of their life, stuff they may have never told anyone else before. The psychologist doesn't reciprocate that level of disclosure. In fact, the psychologist isn't supposed to disclose very much about themselves at all because this isn't a friendship. As a psychologist, especially when you've been working with a client for a while, it's natural to feel a sense of connection and bond with a person. And it's natural to want to root for them and to like the people that they are, but they can never be your friend, because the therapeutic relationship is all about the client and what the client needs and what the client wants to talk about and what's best for the client. So as a psychologist, I don't share very much about myself because that's not the purpose of this interaction. And so one of the really weird aspects of being a psychologist is I form these really deep, intimate, close therapeutic relationships with my clients, but it's entirely focused on them, and I rarely ever share anything about myself. So it's a strange relationship where you have two people who are talking about the most personal, intimate details of a person's life, and that person may not know anything about their psychologist. Now, sometimes psychologists differ in terms of how much personal information they want to disclose to their clients. Some psychologists feel that it's helpful to the therapeutic connection to disclose about themselves and to share personal details of their lives. But I tend not to do that because I find that if I'm bringing in my own stuff into the therapy session, there's a risk that it starts to become about me. And that's not what the client is coming to see me for. At least it shouldn't be. I'm not my client's friend because you don't pay to talk to your friends. And so that's one thing that I really strive to remind myself of. just how strange a social interaction this is and the vulnerability that clients are sharing with me. And that vulnerability comes with a lot of responsibility. Clients are sharing and talking about these really hard and difficult topics and these really upsetting things because they believe that I'm going to be able to help them in some way. And as you can imagine, that's quite the responsibility. If I didn't know how to help someone get over a sexual assault, it would just be plain cruel of me to ask them to provide details about the sexual assault and how it affected them, but then for me to have nothing to say about it or no way to help them. So that's why it's so important as a psychologist to know what you know what you don't know, and to stay in your lane. Now, I know that a lot of psychologists or counselors will treat a wide scope of problems with a wide variety of techniques. But for me, I'm not comfortable doing that because I want to treat the conditions I understand well and use the tools that I know how to use. I don't want to be testing something out when a client's emotions and their psychological well-being is at stake. And that level of responsibility can weigh very heavily on a psychologist's shoulders. I find that, especially when I'm treating anxiety and I'm doing exposure therapy with a client, they have to trust me because I'm asking them to do something that's going to make them feel worse and more anxious in the short term. But ultimately, it's going to make them feel better and overcome their anxiety in the long run. And the client won't do that if they don't trust me and if they don't think I know what I'm doing. So that's why it's really important that I stay in my lane and stick to what I know. And I think all good psychologists do that. But even if I'm staying in my lane, even if I'm sticking to doing what I know, the nature of the therapeutic relationship in psychology is that it deals with a lot of human distress. I often joke with my clients who apologize because they're using multiple tissues because they're crying so much in session, and I usually tell them that I should own stock in Kleenex. If you're uncomfortable with people crying, if you're uncomfortable with seeing people suffer or hearing them talk about the worst pain in their life, being a psychologist probably isn't the right profession for you. The thing is, it's not always easy seeing people in such emotional pain and suffering, be it from depression or trauma or anxiety or having lost a loved one or feeling that their life is meaningless. It can be really hard to hear this stuff. And so, how do you avoid burnout? How is it that a psychologist can have session after session after session where all they're hearing about is people's trauma and suffering and distress? How does that not affect a person? That was one of the things I wondered about before going into psychology. What would it be like? How would I manage being exposed to hearing about people suffering every day, all day long? Well, the thing is, as a psychologist, I don't enter into the suffering with the person. I don't experience their suffering. I don't feel it the way that they do. And that can be a really tricky balance to try and maintain. On one hand, I want to be compassionate and empathic, but on the other hand, I don't want to feel what they're feeling because it makes it really, really difficult to stay objective and focus on the therapeutic goal if, as the psychologist, I become emotionally distraught. On more than one occasion, I've worked with clients where they've told me about past therapists that they've had and that they would talk to the therapist about their history of abuse or some really awful thing that happened to them, and that their therapist would start to cry because they were so touched or moved or affected by what the client was telling them. And it might be a bit paradoxical, but I've never once had a client say, "I'm really glad my therapist cried when I told them about that awful thing that happened to me." Rather, clients who've had this experience usually express some concern that they didn't want to upset their therapist. And so they started to hold back and not talk about things because they were worried and didn't want to upset or distress their therapist. And it doesn't even have to be that the therapist becomes emotional or starts to cry or tells the client how hard it is to hear what they've been through and that they're so sorry that the person experienced that awful event. It can be more subtle than that. Even something as simple as pushing the Kleenex box towards the client who's crying. Even something as seemingly simple and benign as that can portray an important message. If I have a client in my office and they're crying and I push the tissue box to them, the subtle message I could be telling them is that their distress is upsetting me and I kind of want them to stop crying. So there's a lot of nuance and a lot of things to be aware of and to think about when you're dealing with emotionally distressed people as a psychologist. So while it's important to be compassionate and empathic, a good psychologist is able to emotionally distance themselves from the distress and trauma that they're hearing about so that they can focus more on what needs to be done and how to fix it rather than getting caught up in the emotion of it. And that's a really fine line. And again, that's why I say this is such a weird social interaction. You know, the unique thing about the therapeutic relationship is that psychologists are human beings as well, and it's natural to develop a sense of care and connection with clients. Look, I care about all the clients I've worked with, but of course, there are going to be some clients that I just feel a deeper connection with. And these are the clients that I really root for. When I see them making progress, it makes me feel really good because I want the best for them. So when I'm working with someone and I see that they're putting in the effort and I see that they're making progress, there's no better feeling than that because they believe and trust in me and what I'm asking them to do, they're doing it, and they're experiencing life-altering changes. And that's such a cool thing to see. But this is also one of the real challenges of being a psychologist because you work with these clients. They come into your office. They're broken and they're hurting and they're in a dark place. And hopefully you're able to help them. And you see them improve and you see them lighten and you see them get better. And then they don't need you anymore. And honestly, that can be a sad thing. I find it that when I finish working with a client, the final session is usually a bit bittersweet. The client is feeling better, they're excited about their life, they're excited about moving forward, and as their psychologist, I'm excited for them. I'm cheering for them. I'm rooting for them. I want the best for them. But at the same time, it's sad to see them go. You work with these clients, you form a connection, and for some of my clients that I've seen for months or years, it can be sad to say goodbye and know that hopefully I'll never see them again. And for me, that's what makes this such a fantastic job. As a psychologist, you put aside your needs and wants in these deep, personal, social interactions, and you get to focus entirely on another person who puts their trust in you, which is a tremendous honor and a tremendous responsibility. And in doing so, hopefully you're able to help them and you see them get better and you see their life improve and you'll miss seeing them once the sessions are over. But the whole point was, it was never about you. And it's kind of nice, at least from my perspective, that if you're doing it right, the job of a psychologist is pretty selfless. And it may be cliche, but being in a job where I get to help people every day, there's no better feeling than that. And so, in some ways, it's a really selfless job, and in other ways, the rewards of doing the job are so amazing. So, I hope that wasn't too abstract a discussion about what it's like to be a psychologist. If you want to know more specifics or if you have any particular questions about what the job is like, please leave me some questions or thoughts in the comment section below, and I'll do my best to answer them, or I'll do a follow-up video to this one if people are interested in that. In the meantime, if you want to learn more about cognitive behavioral therapy, which is the type of therapy I do, I encourage you to check out this video. So that's all for today's video. As always, thank you for making it all the way to the end of this video, and I will see you in the next one.